Welcome back. Your medical debt may disappear. That's the message out of this week's episode of the 802 News Podcast. Vermont Treasurer Mike Pieciak joins host Mark Johnson to talk about his idea to eliminate medical debt for up to 60,000 Vermonters. Let's take a listen.
It's the full value of the debt as far as they know that they have to repay, and that's what's weighing on them, and that's what's impacting potentially their finances or also their health outcome choices. Like the social determinant of health is sort of this economic stability, and medical debt is one of those. So if you have medical debt, you're less likely to seek medical care for fear of going into even more debt, or you're just have an element of shame, feeling like your provider is not going to want to see you or treat you because you owe them something.
Mark Johnson joins us now. Mark, who is this program targeted to help?
It's targeted to help low and moderate income Vermonters. There are, the criteria for it is you could be up to 4 times the poverty level, which in Vermont is about $80,000 annual income for a couple.
So where exactly is this $1 million going to come from to pay down the debt?
It's already there in a sense. The state has been very aggressive in trying to pay down bonds, money that it owes when it borrows money, and has done quite well in aggressively paying that down. So Mike Pieciak says that there is actually extra money, if you could call it that, in the account that he says would be better used to put into this program. But they've got to get the legislature to sign off on that change.
Of course. So why exactly would creditors take a discount on all this money that they're owed?
Good question. And whether or not they'll take a penny on the dollar is really, I think, the pressure point. There's a national group that has been working on this that has been able to get billions of dollars written off. In a lot of cases, creditors have already kissed this money goodbye. The money is either older than a year and a half trying to be collected, up to 7 years is the criteria of this program. So in a lot of cases, creditors have been trying to get people to pay. Medical debt is the biggest source of bankruptcy, personal bankruptcy in this country. And in a lot of situations, people just can't pay. So the feeling is that they'll take what they can get.
Are all Vermonters eligible to take them up on this?
Well, you don't even need to apply. I mean, the way this is going to work is there's about $150 million in debt that's owed by that group that I talked about before. And they're going to try to negotiate. You don't have to, put in an application or anything, and they're going to see how successful they are and what these creditors will take. So depending on what that magic number is, if it's a penny or a penny and a half on the dollar, that will determine how many people are able to get this written off. But you'll just get a letter in the mail that says that this debt's been discharged.
I'm sure that will be a huge relief. I guess, can you touch on just the true impact of medical debt hanging over Vermonters' heads?
Yeah.
What is that like?
Yeah, well, you can imagine, right? I mean, one of the things that Mike Pieciak talks about that I think he's right is that, medical debt, unlike most other debt we take on, if you want to go out and buy a new car, that's a choice you make. Medical debt sometimes is not really under your control. And to have any kind of debt hanging over you like that is enormous. In some cases, it makes people not want to go back to the doctor because they're afraid that they're gonna want the money from them. There's shame involved, and just the pressure that's involved in having debt hanging over your head. Imagine being able to get rid of that.
Well, thank you, Mark. You can listen to the newest episode of the 802 News Podcast on our website, WCIX.com. Mark, thanks for joining us.
Thank you.